I'm so grateful to Dr. Dan Uslan for spending time with me this morning. He's the Chief Infection Prevention Officer at UCLA, and he'll talk a little bit more about some of the work that he's doing at UCLA Medical Center. And his schedule is very full, as you can imagine right now, but he made generously some time to talk a little bit about the pandemic, about things that are happening locally in Los Angeles, about ways that we can all try to keep each other safe and ourselves safe, and also ways that we can support doctors and nurses and healthcare workers. So first of all, thank you again, Dr. Uslan. What got you into this particular field? What drew you to epidemiology, to infectious disease prevention?
First of all, good morning, and thank you so much for having me. I'm absolutely delighted to be speaking with you. And I think we all recognize that our social institutions, our religious institutions, are an incredibly important anchor during this difficult time. And I really do have great respect for all the work that we're all trying to do to maintain our physical distancing, but keep our social connections as strong as they were. So thank you. So I got into this field at an early age. I actually took I still remember vividly taking a class with my father at what is now the Los Angeles Science Center, I believe, but at the time was the Museum of Science and Industry down in Exposition Park, on creating food out of microorganisms. And we made sauerkraut and yogurt and sourdough bread and things like that. And remember being 5 years old and absolutely fascinated by the world of microbes and how these invisible things could so impact our world. And specifically into hospital epidemiology, it was really a discovery as I became a physician and started practicing infectious diseases as a specialty, that there was work to be done on an individual patient level, taking care of one patient at a time. But this incredible, beautiful world of working on a hospital system level, which is how do we keep all patients safe? How do we keep our employees safe? How do we make sure our visitors are safe and that people are not acquiring infections in the hospital? As you may know, UCLA not only has 3 hospitals, but also I think around 200 licensed clinics now as well. So we've got a footprint throughout all of Southern California. So that means that a patient may show up with measles in our Woodland Hills office, or somebody could show up with whooping cough in Manhattan Beach. And trying to understand how to work on a global level like that to impact not just an individual patient, but the entire system, and has been very rewarding and something I take a lot of pleasure in.
One of the things that I noticed recently, I donated blood at the platelet and blood center at the UCLA hospital. And I've been a blood donor in the past, but I've never seen anything like this, just in terms of the check-in procedures. You had to call right when you got there. They took your temperature, then you went and parked your car. I mean, everything was very, very carefully thought out. And I imagine every aspect of every patient interaction and visit is something that your department works on. Obviously, you have a lot of background in how to do this. But maybe you could just share a little bit about some of the training that goes into this, and some of the ways some of this perhaps has changed over the last 6 weeks or so. Are there new systems that you're putting into place based on some of the things that you've discovered and learned? How do you maintain both the training, but also kind of the flexibility to react to a situation that is dynamic?
Right. So first of all, thank you so much for donating blood. And I would absolutely encourage anyone who's healthy and able to do so to donate as well. I just did it last week, and it's an incredibly important thing to do. There is a shortage of blood right now because a lot of blood is raised through community blood fairs. They've got mobile vans that go and collect, and obviously a lot of that has been curtailed because of this crisis. So it's more important than ever for people to go and donate blood. And as you mentioned, there are a lot of procedures in place now to make sure that that can be done safely and that there's minimal risk to the donor. So I'm so pleased to hear that you did that. Yeah, so I think it's been important and a lot of lessons learned about how to safely do business as usual that's very different than normal. And of course, in healthcare, we're always concerned about things like hand washing and use of personal protective equipment for our employees. And that's been made not only challenging because we're rapidly learning so much about COVID-19 and how it's spread and who carries it. And that's meant that we've had to constantly change our strategies, sometimes virtually overnight, depending on what information we're learning. But also, we've been, like every institution, dealing with concerns about supply chain. And that's something that we never in a million years envisioned as a huge issue. You used to just want a mask, there's a mask, and we would order them and they would show up at our warehouses and we didn't think twice about it. Now, all of a sudden, we're really starting to think hard about how we get our supply chain, how secure it is, what alternatives there might be. So when we have people coming to a clinic or coming to our hospital, making sure that we've got the base underneath, able to deliver safe care. So a couple things that we've started doing. One is really recognizing the importance of symptom and temperature screening for everyone coming into our facilities. And what that means is right now, if you walk into any of our UCLA health hospitals or clinics, your temperature is going to be taken. Now, as you may know, some people don't have a temperature, so it's not a foolproof way of screening people who might have COVID, but it's certainly an important step. But the logistics of that are complicated. You have to figure out who's going to be doing the screening, training them, deploying thermometers, making sure that those thermometers are accurate. So there's a lot of effort that goes into doing even something that sounds straightforward, like, oh, let's just take everyone's temperatures. In the hospitals, we've got a large group of people that come in around 7 a.m. and then 7 p.m., which is our nurses during their shift change. So you may have a trickle of people coming into the building during normal hours, but during shift change, all of a sudden that can be dozens, if not hundreds of people at the same time. And now you've got a line of people stretching out towards the parking lot and making sure that they all stay 6 feet apart from each other, et cetera. The other thing that we've really worked hard on is universal masking, which is essentially that if you come into any of our hospitals or facilities, you're going to be given a mask to wear. We recognize that people are wearing face coverings out in public, and I've seen a lot of bandanas and T-shirts, et cetera, but we're actually giving out formal face coverings to wear for our employees and our visitors. And we feel that with these sorts of things that it is a safe place to come to, and that we're protecting not only our healthcare workers, but our visitors and patients as well.
Yeah, obviously you want to make sure that people who need to go to the hospital or need to see their doctor can do so and aren't so afraid of going that they neglect taking care of themselves in important ways. A friend of mine's a pediatrician, and one of her big concerns is so many children, hundreds and hundreds of thousands, millions of children getting behind on their vaccines.
Yep.
Because parents are understandably afraid to bring them in. What are some ways that parents of kids who are in, vaccine ages, how can they stay up to date? What are some strategies to make sure that we don't create future potential measles outbreaks and other things because of the legitimate fears people have about coronavirus?
Yeah, I think it's a great question. I think the important thing to recognize is that, like you and I are having this conversation, just because we're not out and about doesn't mean we don't need to be still connected, and that regular routine medical visits can continue, at least at UCLA, and I think a lot of other institutions have done this as well, as we've really made great strides over the last few months in telehealth and the ability to have appointments with doctors that are via telemedicine instead of in person. Now, obviously, you can't give an immunization via telemedicine, but you can still have connections. You can still speak with physicians. You can still have appointments, and a lot of things can be evaluated via video, et cetera. And then speaking to the pediatrician about how long can we safely delay immunizations? Are there options for us to come in and get those? What's the environment like in the office? And like I said earlier, we feel very strongly, at least at UCLA, that our office environments are safe because we have all these procedures and processes in place to make them so. And so while we've delayed a lot of medical care in the last couple of weeks and months, I think now is the time to really start re-engaging, speaking to your physician on telemedicine, and then talking about what's essential or what's not.
How is this virus different and similar to all sorts of other viruses that people might be a little bit more familiar with? Because it seems like every day, just as a layperson, reading things in the paper, there's so much that we still don't know. And I'm just wondering, is it typical for it to be so unknown? In some ways, it's very early into this, just a few months. It might feel like years and years already for us. But how is this similar or different than other viruses that you've worked with and worked on?
It's a very insightful question, and I think to your comment, we're learning about this in real time, like everyone else. And one of the silver linings of this whole thing, to be honest, has been the unprecedented sharing of scientific information on a global scale that we've never really seen before, and that has been nice to see. That makes it difficult, though, when you think you know something about this topic, and then the next day there's a new study saying, "Oh no, that's all wrong. It's actually this instead of that." And all of us as physicians and scientists are learning about this in real time, like everyone else is. So, I think a couple things that have been unusual about this virus. First of all, is the degree to which this does appear to be spread by people who have minimal symptoms or are what we call pre-symptomatic, which means that they are going to get symptoms, but they haven't gotten them yet. So you can detect the virus on them, and then 2, 3 days later, they get sick. And it is increasingly looking like those people can transmit the virus. Now, we can talk about things like temperature screening or symptom screening, but if you can be spreading COVID-19 and don't know that you have it, that's obviously hugely problematic. Which is part of the reason that face coverings and masks and face shields are going to become an increasingly important part of the strategy. The second thing that's been really unusual and surprising about this is that the vast majority of people who get this are either mildly sick or have a flu-like illness with fever, cough, which lasts a week or two, but then seems to get better on its own. But there's this percentage of people who get incredibly sick, and we don't quite understand why some people get so sick with this and other people don't. Now, most of those who've gotten incredibly sick are elderly or have underlying conditions of some kind, heart disease, diabetes, etc. But not everybody. And we have seen, and it's been well reported, healthy 30-year-old marathon runners who get struck down by this and are in the intensive care unit. And why it strikes some people and not others is a big mystery that we still don't know. The other thing that's unusual about this virus compared to other ones is, for reasons that are also still unclear, it tends to be extremely inflammatory, and in particularly, it causes a lot of clotting in the blood. And so we're seeing a lot of things like strokes, heart attacks, cardiac arrests in people for reasons that are still unclear. And not a lot of other viruses in this family do that sort of thing. So a lot of unusual things about this that, like I said, we're still learning about. And if you and I have this discussion in another month, I suspect that we'll have very different responses because we'll know a lot more about it.
What are some things that you're personally doing and members of your team are doing to take care of yourselves? Because one of the things that we've all wanted to be able to do at the synagogue, in our Tikkun Olam Center, our social justice work, is how can we provide support for people who are working, incredibly long hours under extreme stress, with also the added layer of fear of knowing that despite all of the things that you're doing to keep each other safe, you are working in a hospital environment. You're coming into contact, depending on, exactly what you're doing in the hospital. You might actually be working directly with patients who are suffering from the coronavirus. So what are some ways that you're coping and members of your team are coping? And I guess also, is there anything that any of us can be doing beyond, sending heartfelt love and thanks, but concrete things that we could be doing to provide more support for our frontline healthcare workers?
Yeah, well, I really appreciate your asking, and I think it's been really difficult. And not to forget that we're all human, and we're all dealing with the same challenges as others, which is family with uncertain school or jobs, dealing with a very quickly changing world, and needing to be there for our loved ones in the same way that anyone would. That we have our own physical and mental health to take care of, and that the normal avenues for stress relief, whether it's sharing a good bottle of wine around a meal at a restaurant with friends or visiting with loved ones or whatever it is, we may not have access to as well. So it's been incredibly difficult. And I think for all of us in healthcare, we're trying to find that new normal that everyone is trying to find, which is how do we adjust to this world that we're living in that's required us to adapt so quickly. And I don't have any solutions. It's been as difficult for me as I think for anyone else. I'll tell you that I'm really starting to try and reappreciate the small things in life that we often take for granted. I sat around my dining room table last night with my younger daughter, and we worked on building a Lego set together. And just those few minutes of having time without the pager going off and without checking my email, and just having a connection with my loved one was incredibly important. We did a Zoom Seder a few weeks ago, like I'm sure many of us did, and ended it by saying not next year in Jerusalem, but next year together as a family again, and trying to have some sort of normalcy in our lives as much as we can. My wife and my younger daughter did a Zoom bat mitzvah with one of her best friends over the weekend, and trying to find ways to connect as people. In terms of how we can support our healthcare community, I think, first of all, just knowing that people are thinking about us and reaching out is so important. And every time I get a text from a friend asking me how I'm doing, or how am I holding up, and having that opportunity to engage, to vent a little bit, to check in with each other is helpful. There are more formal ways, obviously, ways to donate financially, to donate food, supplies if available, and on our UCLA Health website, we have ways to do that, and I'm sure Cedar Sinai and other local local hospitals have similar ways that members of the community can help. But I think just reaching out, checking on people, and seeing how you can help is always a good thing to do.
Thank you. I'm interested, I mean, we all are, and obviously no one can predict this with 100% accuracy, but if you think about sort of what chapter we're in this this saga, this chapter of social distancing, safer at home, how do you imagine, and obviously it could play out in lots of different ways, but how do you imagine maybe the next chapter and the one after that looking like? And again, no one's going to hold you to this. We know that it's just an attempt to try to understand what it looks like. But when people talk about, okay, once we have a vaccine and there's enough people vaccinated, then we can return to normalcy. But we know that that's a long ways off. But between now and then, what are some of the things that we might be able to anticipate? What are some of the things you're thinking about at the hospital? And I'm sure you're also consulting with city officials and other folks so that they can make wise decisions.
So I think it's important to understand that when we don't have a vaccine, or quite frankly, a medication that is known to be effective yet, really the only tool we have to fight this is physical separation. I've been increasingly trying to use the term physical distancing rather than social distancing, because I feel it sends the message that we shouldn't be socially connected to each other. And as we just talked about, I think that's not true. I think I've been very impressed with our public health officials as well as our state and local government officials in terms of the decisions that are being made. And in particular, our governor and our city mayor, I think, are listening to experts and making decisions with the greater good of public health in mind, and making good decisions. And just yesterday or the day before, the governor released a plan in phases for how he sees things reopening in the state. And it seems very thoughtful and evidence-based and logical in my opinion. So I think a few weeks ago, we kind of thought we'd all hunker down for a few weeks, this would all blow over, and then things would go back to normal. And I think we've all started to realize that that's not in fact the case, and that this is going to be with us for a while, and potentially through the fall. And this may become like the flu, where we see it come around on a seasonal basis year after year until there's an effective vaccine available. So I think the tool we have is the physical distancing. And so what that may start to look like is much more use of face masks and face coverings in public. Personally, I'm a big proponent of face shields instead of masks. I think they accomplish much of the same purpose, which is covering your nose, mouth, and eyes, and protecting you from touching those areas, as well as protecting you from getting droplets on you. Plus, they're easier to clean. They're more durable, so you don't have to throw them away. I think that's a more logical long-term solution, personally. I think looking at some of the social, see, I just did it myself, some of the physical distancing that's happened in our businesses. So limiting number of people in grocery stores and pharmacies and Costco, keeping ourselves 6 feet apart from each other. doing all those things and seeing how we can reopen businesses with that sort of thought in mind. And even restaurants, it's not hard to envision where you've got half the number of tables you used to, you limit the size of the number of parties, the wait staff and busboys are perhaps wearing face shields or masks, and you cautiously reopen restaurants. I think we've also learned a lot about how we do hand washing and how we scale that up. And certainly in the hospital, we're always very conscious about that, but seeing a lot more hand sanitizer dispensers in public places. So whether it's the metro line or bus stops or restaurants or grocery stores, and being very cautious about how we clean our hands. So I can see what the new normal might look like for the next few months. Face masks, face shields, lots of hand washing, and then really more enforcement of physical spread from each other when we're in public places.
One challenge that I'm sure folks like you and county and city and state officials are, of course, dealing with is being part of a much larger country that it might have different approaches in different states. How do you piece together a response in a vast state like California, over 38 million people or something like that? What happens when other states, Georgia and other states that are now experimenting with opening up in different ways, and might be doing so, and not to get political, but might be doing so in ways that aren't evidence-based or science-based. Obviously, our president has said some things that are clearly not evidence-based, science-based. No doctor could possibly support them, whether there was sarcasm or not. It's unbelievable for me to hear these kinds of things. What can we do to, as Californians, because I think a lot of us are feeling like our mayor and our governor and county officials really are doing all of the right things to try to keep us safe, notwithstanding the challenges and pain that comes with that economically and otherwise. Right. How do we get through this if we're doing it in a piecemeal fashion? Are there conversations that are being had about that?
Yeah, absolutely. And I think it's really emphasize the point that this is a global world that we live in, and that this is a interconnected world, and that strict border controls, strict closing of borders is not an effective strategy when you've not only got people coming from all over the world internationally, but also state by state. And if state A is doing something completely different than state B, you're not shutting down borders of states. So that's really not a strategy that you can build upon. I think a couple things. One is we have to assume that this is present in our communities, whether we know it or not. And that's why the physical distancing, face coverings, hand washing, et cetera, become so important. So that if somebody's flying from Atlanta to Los Angeles, so we're just assuming that everybody is potentially infectious. Another thing that I think is going to be incredibly important is improving access to testing, which right now is much better than it was a few weeks ago. And I think we are leaps and bounds better in California than a lot of other places. Certainly the president's statement that anybody who wants a test can get a test is far from realized. But if we could get testing widely available, easy to do, and shorten the turnaround time on a result of the test, that would help tremendously as well. And as you start to think about industries reopening, whether it's movie sets or restaurants or office buildings, if I could test all the workers on a standing basis once a week, for example, and it was a test that was not painful, getting a swab put all the way back in your nose is uncomfortable. But if it was something as easy as saliva, for example, and I could get the results in a couple hours, that would be a strategy to just, let's assume that everybody has this. Let's test everybody and send you home if you test positive. And then the other thing that you're going to start hearing more and more about is ability to do very robust contact tracing. And if you're not familiar with that term, that essentially is one of the fundamental tenets of epidemiology, going back to John Snow and the cholera outbreak that kind of started the field of epidemiology, which is let's interview everybody who we know is sick, find out where they've been, who they contacted, where they go, who they live with, and then talk to all those individuals and try and really identify where this has spread to. The infrastructure required to do that when you've got a couple patients here and there is not so bad, but when you're talking about tens of thousands of people is incredibly complicated. And I think you're going to start hearing more and more about almost a Peace Corps-like call for volunteers to start being trained on how to do contact tracing so that we can do that broadly on a societal level. And that way we don't have to worry about if state A is doing something different than state B. We just have a uniform approach to how we investigate this.
In terms of things that each one of us can do to keep ourselves safe, obviously physical distancing is critically important. Are there other things that that you're wanting us to be thinking about in terms of our own health and well-being and safety, and that of others? That, you know, if you could get everybody in Los Angeles County to adopt some of the things you've already mentioned, certainly whether it's a face shield or other kinds of face covering, what are some of the things that we can all be doing just to keep ourselves healthy, but obviously make your job easier and keep others healthy?
So I think the first one is a recognition that we don't do anyone any service when we go out in public sick. And I think we've all been there. We've got a mild runny nose, a little bit of a cough, a sore throat, and it's just a cold, and I'm going to go on about my life. And I think recognizing that this is different now, and that we're really not helping anybody when we're going out. And that's especially for people who go to work is a little bit of a different philosophy, and is going to take some getting used to. Is this idea that the technical term we call it in medicine is presenteeism. It's the opposite of absenteeism, which is working when sick. So if you're sick, stay home, talk to your doctor. Doctors now are available by phone, via telemedicine, telehealth, but not going out when you're sick. Really emphasizing hand hygiene. I think it's just incredibly important to keep your hands clean at all times. Even when we're subconsciously not even aware of it, we're constantly touching our noses, our mouths, our faces, and carrying a little bottle of hand sanitizer around and liberally using it, I think, is incredibly important for members of the public. And then lastly is, I think, not neglecting the rest of our health. And again, when we thought this would be over in a couple weeks, it was okay to put off routine medical care and say, you know, that prostate biopsy that my doctor wanted me to have, that can wait. I think now is the time to recognize that we probably need to start moving ahead with some of that stuff, and the things that have been deferred maybe should now be re-engaged, and reaching out to doctors, and remembering that while health from COVID is obviously worrisome, neglecting the rest of our health doesn't do us any good. And we're all in healthcare worried that we're going to start seeing a second wave, not of COVID, but of these other things that have been delayed and deferred and neglected because people were worried about coming out in public and engaging. And so I think recognizing that hospitals and doctors' offices now are safe places to go to, and speaking to your doctor about what can be postponed or not is really important. And I don't want anyone to be sitting in pain because they've put off that hip replacement for 3 months now, and they just don't see an end to when they can finally get it. Now's the time to start talking to the doctor again.
Finally, I just wanted to get a sense, you mentioned a little bit of this when you talked about spending time with your daughter, making Legos, and having an opportunity to gather with family, even if it was virtually for Seder. What are some of the things that really get you up in the morning, inspire you in the work that you're doing, and help you to navigate all of these challenges? Are there some things in particular that help you to be inspired and to have that focus so that you can go about the difficult and challenging work that you're engaged in?
Yeah, so first of all, I am a family man, and the thing that gets me up in the morning is my wife and 2 daughters, and knowing that the work that all of us are doing in the hospitals is keeping our loved ones safe. We have an incredible team at UCLA, and this has been hundreds, if not thousands, of people that basically have given up their normal day jobs and focused solely on this for the last few months. And I feel very honored and privileged to work with such a distinct group of people who are so dedicated and hardworking. And knowing when I get to work in the morning that I've got all my my family at home, but also my family here that are passionate and driven and hardworking is what gets me up in the morning. But just like all of us, there are days where I get up and I want to have a cup of coffee and then go back to bed. And there's times where say, you know what, today is not a good day, and I'm going to go home a little bit early and hang out with my loved ones. And I don't have a secret to this any more than anyone else. I think it's just a matter of taking it one day at a time and trying to keep the mission in front of us, and remembering that this is the stuff that we're doing is stuff that is societal. It's not just for ourselves, it's for everybody, and we're working to do that.
I want to thank you so much. One of the names of God in our tradition, and there are many ways that God is known, but one name for God is Rofei Cholim. God is the healer of the sick. And we're grateful to you and all of the healthcare professionals who are working so hard to keep us safe, not just during this difficult time of pandemic, but all the time. So thank you for making special time for us today. And I'm excited to be able to share this with our congregation. And if there are ways beyond the things that we see on your website, which of course we'll look at, beyond giving blood and of course keeping ourselves and others safe, if there are ways that we can support you in your work, please don't hesitate to reach out to Stephen Wise Temple. Thank you so much for your time.
Thank you for having me, and stay safe, stay healthy, and hopefully stay sane as well. We're all in this together.
Thank you,
you.
Doctor.